Welcome to Scrubs Tutors. This channel is built for nursing students in programs like Walden, Chamberlain, and others using iHuman, focused on helping you break down cases, sharpen your clinical reasoning, and consistently improve your scores. And to those who've been supporting the channel, thank you. It doesn't go unnoticed. If you're struggling with iHuman cases, it's probably not your diagnosis. It's your history. This is where most of your points come from. And if you don't get this part right, everything else falls apart. In this video, I'm going to show you exactly how to take any chief complaint and turn it into a high-scoring history of present illness, every single time. Let's get into it. Start every case the right way, with 2 open-ended questions. How can I help you today? And, are there any other symptoms or concerns you'd like to share? Simple, but powerful. This gets you the chief complaint immediately and builds rapport at the same time. Now, once you have that chief complaint, don't hesitate. Go straight into OLDCARTS. This is your framework, and you need to use it every time. Onset, location, duration, characteristics, aggravating and alleviating factors, related symptoms, treatments tried, and severity. You're asking, when did this start? Where is it? How long has it been going on? What does it feel like? What makes it better or worse? Any other symptoms? What have you tried? And how severe is it? If you systematically hit all of these, your HPI will be strong. If you skip them, your score will reflect it. Once your HPI is solid, move forward. Don't stop there. You need a complete review of systems, and you need to document pertinent negatives. That's where a lot of students lose points. Then cover the essentials: past medical history, medications, allergies, social history, and family history. But here's the key: stay relevant. If it's a rash case, think exposures, travel history, family atopy. Don't just click through questions. Be intentional. Now let's talk strategy based on case type. For pediatric cases, like early week rashes, you need to ask about birth history, immunizations, developmental milestones, and the parent's concerns. For acute pain cases, like abdominal pain, zero in on GI and GU symptoms, diet, and the last meal. And for chronic or neurological cases, shift your focus to functional impact and red flags. That's where the high-yield points are. Here's a pro tip that separates high scorers from everyone else. Document your key findings as you go. Don't wait until the end. If you do, you'll forget something, and that costs points. And finally, the biggest mistake: rushing the history. If you rush OLDCARTS or skip steps, you make the entire case harder than it needs to be. But if you slow down and do this part right, everything else, your exam, your diagnosis, your plan, becomes much easier. This is your foundation. Master the history, and your scores will improve immediately. In the next video, we're breaking down the physical exam step by step. If this helped you, hit like, subscribe, and stay locked in. And if you're working on a case right now, send an email with the case as the title. I'll help you break it down. I'll see you in the next one.